Understanding ADHD. Beyond the misconceptions. ADHD. You hear it everywhere. People throw it around lightly. But what is it really? ADHD is more than just being fidgety or forgetful. It's a real medical condition. It impacts people's lives in significant ways. Many people think ADHD is just an excuse. They think kids with ADHD are just badly behaved. This is simply not true. ADHD is a neurodevelopmental disorder. This means it affects the brain's development and how it functions. People with ADHD face real challenges. They struggle with attention, focus, and impulsivity. These challenges are not their fault. They are a result of their ADHD. We need to move past these misconceptions. We need to understand ADHD for what it truly is. It's time to separate fact from fiction. Let's talk about how doctors see ADHD. Doctors classify ADHD as a neurodevelopmental disorder. This means it affects the brain and its development. The American Psychiatric Association, or APA, provides specific criteria for diagnosing ADHD. These criteria are important. They ensure a proper diagnosis. They also help doctors distinguish ADHD from other conditions. Brain imaging studies show differences in the brains of people with ADHD. These differences are in areas of the brain responsible for attention, impulse control, and executive function. These differences are real. They are not imagined. There is no single test to diagnose ADHD. Doctors use a comprehensive approach. They consider a person's history, symptoms, and observations. It's about putting all the pieces together. ADHD is not just a diagnosis. It's something people experience every single day. Imagine struggling to focus on a task. Your mind races. You get distracted easily. This is the reality for many people with ADHD. Everyday tasks can be a challenge. Organizing, planning, and completing tasks can feel overwhelming. It's not that they don't want to do it, their brain makes it harder. Relationships can be affected too. Difficulty with impulse control and emotional regulation can lead to misunderstandings. This can strain relationships with family and friends. People with ADHD are often misunderstood. They may be perceived as lazy or unmotivated. The truth is, they are working harder than you know. Navigating life with ADHD. Rights and accommodations. People with ADHD have rights. They are entitled to support and accommodations. These accommodations help them level the playing field. The Americans with Disabilities Act, or ADA, protects individuals with ADHD. This act prohibits discrimination based on disability. It ensures equal opportunities in various areas of life. Educational accommodations are crucial for students with ADHD. These may include extra time on tests or assignments. They may also include preferential seating or the use of technology. Workplace accommodations can be equally important. Flexible work schedules or quiet workspaces can make a big difference. These accommodations help individuals with ADHD thrive in their jobs. Dispelling the myths, ADHD under the microscope. Myths about ADHD are like weeds. They grow quickly and choke out the truth. Let's clear the air and debunk some of these myths. Myth number 1. ADHD is just a lack of willpower. Wrong. ADHD is a neurological condition. It's not about laziness or a lack of effort. Myth number 2. People with ADHD can just snap out of it if they try hard enough. Absolutely not. ADHD is not a choice. It's not something you can simply will away. Myth number 3. ADHD is a childhood disorder and goes away with age. False. While symptoms may change, ADHD can persist into adulthood. Myth number 4. Medication is the only solution for ADHD. Not necessarily. While medication can be helpful, other treatments like therapy and lifestyle changes can also be effective. ADHD in context. Differentiating from other conditions. ADHD shares similarities with other conditions. It's important to distinguish it for effective treatment. Anxiety and depression often co-occur with ADHD. These conditions share some overlapping symptoms. This can make diagnosis tricky. Learning disabilities like dyslexia can also coexist with ADHD. It's crucial to identify and address each condition individually. A comprehensive evaluation is key to accurate diagnosis. This involves gathering information from multiple sources. This includes medical history, psychological testing, and observations. Understanding ADHD is crucial. It's about separating fact from fiction. It's about dispelling myths and promoting empathy. People with ADHD deserve understanding and support. They deserve to be seen for who they are, not defined by their diagnosis.